Don't tell me that evidence-based physio is the holy grail to solve all our physio problems. That's a load of hogwash. So let's be honest, your evidence-based praxis doesn't help burnout and staff shortages. It doesn't help with research gaps between what is published and what we need in the clinic. It doesn't address the regulatory or licensing issues. It doesn't help public health or wait times. It doesn't foster integration with other healthcare professionals. Yes, evidence-based practice boosts our professional credibility by relying on science. We move beyond anecdotal experience. I'll give you that one, but I'm not dismissing its value entirely. Of course, grounding our profession in science is crucial, but what about the messy, complex cases that don't fit into our research studies? I've been there too, juggling demanding patients, navigating unclear diagnoses, and wondering where the evidence is that I need. The medical literature can feel detached from our daily physio reality. That's why I'm passionate about sharing real stories, real advice, and practical wisdom, not just summaries of research articles or theoretical frameworks. That's why I'm here. In this video, we'll explore the limitations of evidence-based practice in physiotherapy, where it falls short, alternatives to the evidence-based practice, what else can inform our decision-making, blending evidence-based practice with expert opinion, that sweet spot for optimal patient outcomes, and as a bonus, let's talk about the evolving practice from ancient wisdom to modern efficiency. By the end of this video, you'll be informed, surprised, and maybe even a little angry with me. But enough chin-wagging, let's get this party started. Section 1, the limitations of evidence-based practice in physiotherapy, a clinician's perspective. As clinicians, we know that evidence-based practice isn't a one-size-fits-all solution. I have 5 major limitations to evidence-based practice in physiotherapy. Research doesn't always translate into clinical practice. Study participants may not match who I see in the clinic. There's a different socioeconomic status, a different medical history, different body mass index, psychological issues, lifestyle choices. Outcome measures may not matter. Research focuses on metrics that may not be relevant to our patients' needs or our clinical goals. Outcome measures in physiotherapy aren't standardized, and some are behind paywalls. Qualitative research gets overlooked. Many people think that numbers and measurements are more important than what a patient feels and experiences. Good care includes the patient. Time constraints. Keeping up with new research in physiotherapy can be hard because there's so much new information all the time. It can also be tricky for physiotherapists to figure out which studies are good and helpful. Barriers to access. It used to be that we had to go to the medical library to read the articles, but the internet brings everything to our screens. 2 big hurdles for working physios are journals and database paywalls and the lack of supportive colleagues to interpret and to implement these latest findings. What it boils down to is that evidence-based practice isn't perfect. We need a balance of research with clinical judgment. We need to consider each patient as an individual person, and we need to stay up to date but not be overwhelmed by it all. Beauty, eh? Let's get into alternatives to evidence-based practice. Section 2, alternatives to evidence-based practice for physiotherapy. Now don't get me wrong, evidence-based practice is fantastic. Some of my best friends use evidence-based practice, but sometimes we need to think outside the box or just think for ourselves. Let's explore 3 real-world strategies to help you become an exceptional physiotherapist. First, trust your instincts, experience-based knowledge. As you gain experience, you'll develop a 6th sense for what works and what doesn't. Don't underestimate the power of intuition. That was Daniel Kahneman's book, Thinking Fast and Slow, that talked about System 1, automatic type gut thinking, versus System 2, the slower, more deliberate, more logical thinking. So listen to your patients, consider their unique needs and their unique situation, and then trust yourself. I know it's hard to trust your gut if you don't have a lot of experience, but that's where you can ask coworkers and mentors to uncover secrets you didn't know existed. 2, uncover hidden insights, your own real-world evidence. We're sitting on a gold mine of clinical observations, treatments, and patient feedback. Let's standardize charting and share the knowledge. By analyzing real-world data that we already have, we could uncover valuable insights into what's working and what is not working that may not make it into formal studies. For example, I remember learning to treat a frozen shoulder with ice and vigorous manual therapy, but I wasn't seeing the results I wanted. So I tried heat and gentle passive range of motion therapy exercises, and the results were better. So no big research study, just a lonely physio in a big world asking himself questions. 3. Learn from others and yourself. Reflection is key. Take the time to evaluate each session and seek mentorship opportunities. Connect with seasoned pros, join online forums, and engage in vibrant discussions. Additionally, consider regular peer review sessions. Talk to other physios about those challenging cases. We all have them. It's called constructive feedback and seasoned insights. You'll create a supportive network that fosters continuous learning and growth. This network will help you refine your skills and stay up to date on the best physio practices. It's like talk therapy for your physical therapy. While evidence-based practice is crucial, experience-based knowledge, real-world evidence, and collaborative learning are just as vital. Embrace these alternatives to deliver our best care. Section 3, blending evidence-based practice and expert opinion in physiotherapy for optimum patient outcomes. I'm sure you're likely familiar with the delicate balance between evidence-based practice and clinical intuition. This balance is crucial because one misstep can significantly impact patient outcomes. I remember facing this challenge early in my career, feeling uncertain about how to proceed and when research and instinct collided. Research, while essential, isn't always clear-cut. Studies have limitations, and what works wonders for one patient may fall flat for another. This is where clinical expertise comes in, adapting treatments to individual patient needs for the patient in that situation. However, questions linger. How do you know when to trust your instincts? How do you know when to rely on the evidence? And when should you lean on your clinical judgment? The key to finding harmony lies in blending evidence-based practice with clinical expertise. By merging these two approaches, you'll unlock personalized care, tailoring treatments to unique patient needs and preferences. Informed decision-making becomes second nature when you balance the evidence and your clinical judgment. Continuous learning is also vital, staying up to date with best practices and new research to refine your skills. We need to recognize the value of both evidence-based practice and clinical expertise in developing your critical thinking skills that will help navigate complex cases. That's why I'm making these videos. Seeking mentorship and peer feedback provides valuable perspectives, ensuring you stay on track. By embracing this balance, you'll deliver the best possible patient care. In physiotherapy, we often say that our profession is both an art and a science. By embracing this balance, we deliver top-notch care that transforms lives. Remember, it's not about relying solely on the research or instinct. It's about finding that sweet spot where evidence and expertise come together. The bottom line here is that embracing the balance between evidence-based practice and our clinical expertise will improve your clinical results and foster your own personal professional growth. You ready for the bonus section? Because you've made it this far. The bonus section, from ancient wisdom to modern efficiency, evolving physiotherapy practice. We need to talk about where we came from, where we're at now, and where we're going. 1. From ancient wisdom to modern efficiency, evolving physiotherapy practice. Physiotherapy has evolved over the last thousands years. Modern foundations began with pioneers like Hippocrates and Galen, who used technique like massage and joint mobilization. In the 1800s in Sweden, Per Henrik Ling founded the Royal Central Institute of Gymnastics that solidified physiotherapy's modern presence. The Chartered Society of Physiotherapy in England was actually founded in 1894 as the Society of Trained Masseurs. It wasn't until 1913 that the organization changed its name to the Chartered Society of Massage and Remedial Gymnastics, and then finally in 1943 it became the Chartered Society of Physiotherapy. So we've been struggling with a branding issue for a while. The First World War and then the Second World War really catapulted physiotherapy forward as a profession in terms of helping the world recover. Today we have technology and research and evidence, but patient care is still what we do best. 2. Today's challenge, balancing the art and science with the 80-20 rule for physiotherapy success. As physiotherapists, we've all encountered this familiar scene. Most patients respond well to straightforward treatments. However, a small group requires more complicated care. This phenomenon is known as the 80-20 rule. 80% of positive outcomes come from 20% of our efforts. This 80% majority This group consists of patients with simple diagnoses and treatments that respond well to basic physiotherapy skills. Let's look at 3 examples. Patients regaining motion after fracture mobilization, patients with osteoarthritis improving strength and balance for walking, patients overcoming tennis elbow with grip strength exercises and manual therapy. These patients typically respond well to standard physiotherapy interventions, yielding predictable results. Yet there's a 20% minority. In contrast, this group presents with more complicated challenges. They require a greater amount of time, more resources, with less predictable outcomes. These patients often present with non-specific complaints, but full range of motion and near normal strength. Think non-traumatic low back pain or intermittent shoulder pain. They often have vague or complicated diagnoses, making prognosis uncertain. This can stall our treatment planning. They often have chronic pain that's persisted despite multiple professional interventions. They tend to have a preference for quick fix, passive treatments over active exercises. This concerns us since active exercises are the key to long-term pain relief. It's frustrating, but we see this minority 20% of patients all the time, and we need to help them. They need a nuanced strategy. Research evidence by itself won't solve this. 3. Thinking outside the physio box. Collaborative care for this challenging 20% minority. As physiotherapists, we've all seen this minority 20% of tough patients. These patients can be difficult to help. They need us to think differently. That's where a multidisciplinary team comes in, collaborating with experts from various fields to bring patients back to normal, back to a functional baseline, and to get them out of the healthcare system. We need to break down silos and work with other professionals. Everyone talks about these multidisciplinary teams, but in real life, I have not seen very many of them over the last 30 years. Ideally, my dream team would have a core of specialized team members, and then we'd invite experts in as needed. I would like to have a registered nurse who would be able to connect with patients and resources and support lifestyle changes. A physiotherapist on the team would be able to assess and set rehab goals. A medical doctor would be able to manage medication and order imaging. A psychologist would provide cognitive behavioral therapy support. An occupational therapist would be able to modify daily activities and recommend devices. Imagine having a dream team that delivers comprehensive patient-centered care to those tricky chronic physio patients. Each profession brings its own blend of research and clinical expertise to the table. Physiotherapists with our evidence-based practice won't solve this. In reality, this team might look different depending on where you work. Maybe it's a family doctor who's coordinating care or a community care nurse connecting the dots. The key is recognizing when patients need more than what our physio alone can offer. If you're seeing these patients repeatedly without progress, it's time to think differently. Conclusion: the path forward for physiotherapy embracing balance and innovation. Physiotherapy regulatory bodies face a daunting challenge of balancing public safety with the needs of their member physiotherapists. To achieve this balance, it's essential to prioritize practical wisdom, balancing rules and discretion, and focusing on outcomes rather than processes. One of the primary challenges in regulating physiotherapy practice is the inherent difficulty in policing it. Unlike other medical fields, physiotherapy lacks common diagnoses and treatments vary significantly between practitioners. For example, low back pain treatments vary considerably. Compounding this challenge is the vast and varied nature of evidence-based practice. Regulators must navigate the complexities of interpreting evidence, deciding what constitutes an acceptable intervention. For example, traction for low back pain is common despite lukewarm guidelines. By comparison, popular taping methods have very little evidence. Similarly, myofascial release is common and popular with physiotherapists, but lacks research basis. Similarly, foam rolling isn't supported by evidence, but it is in popular use. Many of our treatments are popular with patients, popular with physios, but poorly supported by evidence-based practice. This raises an important question about the role of evidence in regulation. To effectively serve public safety, physiotherapy regulatory bodies should adopt a risk-based approach, focusing on high-risk areas rather than imposing an unenforceable requirements for evidence-based practice. Outcome-based measures should be used to evaluate physiotherapists, prioritizing patient outcomes over strict adherence to protocols. In serving member physiotherapists, regulatory bodies should prioritize flexibility and autonomy, allowing experienced professionals to exercise judgment and adapt treatments to individual patients. Support for continuing education is vital, providing resources and incentives for ongoing learning rather than solely enforcing evidence-based practice. Recognizing expertise within the profession is also essential, valuing specialized knowledge and skills. And we need room to grow as new ideas, new devices help our patients in the future. Ultimately, regulators must recognize that evidence alone is insufficient to ensure public safety. By embracing practical wisdom, balancing rules and discretion, and prioritizing outcomes, regulatory bodies can create an environment that supports both public safety and the professional growth of its member physiotherapists. Throughout this discussion, I've highlighted the nuances of balancing regulation and professional autonomy. I'm eager to hear from you about your evidence-based practice. How do you make decisions when there's no clear evidence to guide you? How has navigating board requirements impacted your day-to-day practice? Share your experiences and insights in the comments below. My 2 books are now available at Amazon. What They Don't Teach You About Documentation in Physiotherapy School, a short how-to manual for successful daily note templates, and From Injury to Recovery Through Exercise, simple functional exercise progressions for physiotherapists to restore lifting, standing, walking. Thank you for your support. It's time for another video, and this one will make you smile and unlock a world of timely updates by subscribing to my channel. Thank you.